Hello everyone, this is Dr. Jawad. Thank you for tuning in. I'm continuing my series on the metabolism of estrogen. I've already done videos 1 through 4, so if you haven't done those, just follow the links down below and get yourself up to speed. Now with this one, I talked about phase 1 and phase 2, the breakdown of estrogen into the metabolites. Now phase 3, this is the gut, how it's absorbed in the gut. So when it comes down to phase 3, this is very, very important. Now estrogens, remember for the females, you have a 28-day cycle. So your estrogen levels and progesterone levels, they fluctuate every single day. Guys, we're pretty much, we peak our testosterone at 28. It's like a slow downhill battle ever since. But still, elevated estrogens in males are typically due to sugar, alcohol, wheat, gluten, inactivity, because adipose tissue, your fat, also produces estrogen. And for males, when the imbalance occurs, you have 80% testosterone, 20% estrogen. What happens is that that teeter-totter starts tipping over. Okay, so this could affect males as well, but I want to step us aside. Let's talk about the females. So when it comes to gut health is very, very important, because after the hormones are metabolized in the liver, phase 1 and phase 2, some of the conjugated estrogen, which is bound, okay, is excreted in the bile and the small intestines. Now when it comes to the small intestines, it's like a tube, okay? So the outside tube, that's the epithelial lining. It's a very thin lining, but inside they're like little finger-like projections, and that's called the lumen. Now inside your intestines is a nice bacterial bed. Everything's a nice bacterial bed, and that bacterial bed needs to be healthy, okay? And that's a microbiome. It plays a key role in the circulating estrogens. Now with the microbiome inside the small intestines in conjunction with the estrogen, it's called the estrobolome. Okay, the estrobolome, that's a circulating bacteria. It's capable of metabolizing and modulating the circulating estrogens. Now, if there's a dysfunction in the estrobolome, this is the key reason of why there's weight issues, libido issues, mood issues. Because the estrobolome releases an enzyme called beta-glucuronidase. The function of that is to break down the conjugated estrogen to be reabsorbed in the bloodstream. And it passes through, it passes the epithelial lining and back into the bloodstream. It goes where the receptors are needed. The thing is, the estrobolome, that gut lining, can be affected by too much estrogen. Birth control pills, high estrogen diet, estrogen dominance, diet, antibiotic use, lifestyle, age, alcohol. There's a lot of factors involved that will affect this bacterial bed. This is why, first and foremost, let's clean up the diet. Let's work on the bacterial bed. Let's get some probiotics, because like a freshwater fish tank, if that bacterial bed needs to be a certain pH. If it's too clean, what happens? The fish die. If it's too dirty, what happens? The fish die. So there needs to be a balance. And this will affect men as well, but again, I'm focusing on the females. Because the main thing is, you want to work, when I work with patients, I want to focus on the diet. Diet, 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 because let's clean up this bacterial bed. So what happens when you have imbalances, you have dysbiosis. Dysbiosis is imbalance of the gut bacteria. If you have an imbalance of the gut bacteria, that bacterial bed in your fish tank is either too dirty or too clean. What's going to happen? You have an increased beta-glucuronidase. We don't want that. Why? Because if you have the increase of the enzyme, then you're going to break down more estrogens. Now you're going to have elevated circulating estrogen levels. That is not good, especially for postmenopausal females and males. Why? Because for females, you're going to look at endometriosis. Cancer is estrogen-based. Remember, the function of estrogen is cell replication. Cancer loves estrogen. Why? Because the estrogen does the dirty work for the cancer. It makes the cells replicate faster. Breast cancers, endometrial cancers, cervical cancers, any type of cancers for females, again, estrogen-based. Males, same thing. The reason why males get, one of the reasons, I don't want to say reason, one of the reasons why males get prostate cancer is not because it's your testosterone level. It's because you have too much circulating estrogen. Now, what happens on the flip side if it's too low? Again, what if that fish tank is too clean or too dirty? Well, then it's low diversity. You have a lack of the microbiome. The fish tank is too clean. What's going to happen? You're going to lower that beta-glucuronidase. What's going to happen if you lower that beta-glucuronidase? You're going to have lower circulating estrogen levels. And why is that bad? Because now for females, you're looking at bone health, cognitive function, gut health, overall women's health in general, especially postmenopausal females. Why? Because you already have low circulating estrogen levels. You don't need it any lower. Okay, so I hope this helps. Please leave a comment down below. Again, if you like it, let me know why. If you don't like it, let me know why. If you have any other topics you want me to touch on, please do. Thanks for watching. Okay, so when it comes to the gut biome and the modulating estrogens, these are certain conditions that first and foremost, let's start off with the gut. Let's fix the gut biome. Because remember, if that gut biome is unbalanced, you may have too much or too little circulating estrogens, which can affect or give you certain diseases. For example, like for females, estrogen dominance, metabolic syndrome, cardiovascular disease, yes, males could have that as well. Fertility issues, yes, males could have that as well. PCOS, endometriosis, cancers that are more estrogen based, like your breast cancer, endometrial cancer, cervical cancer, ovarian cancers, cognitive function. The brain for females loves estrogen. For males, if we have too much circulating estrogen, what's going to happen? Enlarged breasts, man boobs. Man boobs are everywhere nowadays. I could go down to a pool, to a beach, and I can see everybody with man boobs. What the heck? Infertility, yes. Males, this could be one of the issues why you're having sexual dysfunction. You may have more circulating estrogen than testosterone. Okay, so hope this helps. Thank you very much. Please leave a comment down below. Be good.